So this important video is going to show you how to implant an IUL from a pinpoint pupil. When the pupil fails to dilate, as the patients of diabetes are growing in, such patients present to you more and more often when the pupil is small, and it comes down to even smaller sizes when you have to implant an IUL from such a small pupil. So I'm doing I&A right now, and you can see, I'm shifting the globe to appreciate a good fundal glow, and I have noticed that the right side of the cortical cleanup has been done and the left side of the cortical cleanup is yet to be done. I am just putting the irrigation cannula on the left side and the aspiration cannula on the right side, and I am going to switch on the aspiration part from a phaco pedal in the clock hours. I generally like to do in all the clock hours so that you know that you have not left any cortical remnants in the patient's eye. So as you can see, the pupil is around 20 to 10% dilated. It's a normal meotic pupil, and yes, we are going to implant a monofocal J&J IUL, Johnson & Johnson IUL. The trick is to go about implanting the leading haptic and the leading optic part down with an angle of 30° to the iris. And yes, the trailing haptic, that as the IUL starts to unfold, you just nudge the trailing haptic with your cannula down to the iris and down to the anterior capsule in the bag. With experience, you're going to notice that there is a small distance between the iris and the anterior capsule, and just like that, you nudge it deep. Don't nudge it superficially, that way, you're going to implant the IOL in the sulcus. And just for my confirmation, I love to confirm that it is in the bag in 2 or 3 locations, and this is the third location I'm checking it in, that it is in the bag. It has been well placed in the bag. And yes, I'm pretty happy by now that the IOL is not been placed in the sulcus, but it is in the bag. And this is the way to do it. This is the correct way to implant an IOL from a small pupil. Just for your quick reference, this is a diagram, anterior segment OCT, that shows the way it is done. This is the sulcus, the lens in the red, and the yellow part in the iris is the iris. You don't have to put the IOL between the anterior capsule and the iris. That we are going to implant it in the sulcus. You just nudge it 0.1 to 0.2 mm down to the iris. Make sure it is in the bag after the end of the case by just pulling the iris apart in 2 or 3 locations. And that's all from my side. It was a small quick fun video because the number of small pupil cases are increasing these days of the diabetic patients that you see, and you have to implant small pupil IULs as well. So this was a good trick for you all to just enjoy and learn. Kindly like, share, and subscribe. And that's all from my side. This is Dr. Semanchal Goel signing off, hydrating the main port for you guys. Thank you, and have a great day ahead. This is a small pupil, beautiful Johnson & Johnson IOL staring at you. Thank you.